So my assistant and I just arrived at our client's house, and before she's been lying with her hips elevated for about 20 minutes. So before I begin the procedure, I am going to check in with her, make sure to answer any last minute questions, and then begin the procedure. I'm going to start by confirming the baby's positioning. So I will feel the baby, just confirm that they are indeed still breech. I do feel a ballotable pull at the fundus, and then another pull down in the pelvis, but it is not engaged. There's wiggle room. I also am feeling the baby's back toward the parent's left side, and their head feels well flexed. My assistant will then get heart tones for 2 minutes to establish a baseline heart rate for the baby. And then we're ready to begin. I'm going to put oil on my hands and on the client's belly to reduce the amount of pulling on her skin. And then I will put one hand on the baby's head, the other at their rump, and gently rock and massage the baby up out of the pelvis. And once the baby's up out of the pelvis, then I will continue by moving the baby in a sort of somersault type motion, nose to tummy, taking it very slow, stopping for rest every 1 or 2 minutes and to listen to heart tones. And I continue to move the baby's head toward the pelvis and their rump toward the fundus. If at any point in the procedure the baby has any decels, won't move any further, the client has abdominal pain or contractions, or they request that I stop, then I would stop the procedure and move the baby back to their original position. So the version is complete. I am going to again confirm positioning is head down, and listen to heart tones for 3 minutes. After that, I will have the client stand up and be vertical for at least an hour. We would continue to monitor heart tones every 20 minutes during that hour. The client can walk, squat, lunge, any kind of motion that's going to encourage the baby to engage more deeply in the pelvis. We're also watching for signs of complications, including decreased fetal movement, contractions, bleeding, leaking fluid, abdominal pain, and abdominal pain. After that, I would document the procedure and the results.